first of all, good morning and welcome everyone for coming today. Thank you all for joining us on this Wednesday morning. So first of all, I think we'll just do some introductions. My name is Craig Moore. I'm the National Events Coordinator for the FSB. I've been running webinars since lockdown started, and we're lucky to be joined here today by Nikki and James from RiskX. And I'll just let Nikki and James do a quick 2-minute introduction, and then we'll get on with the conversation.
Excellent, thanks Craig. Well, I'm Nikki Same, I'm the Marketing Director for RiskX. I've spent nearly 20 years now in the area of risk and health and safety management, and have lots of case studies and stories to lean on to share with you today.
I'm James Sharp. I'm the Chief Technical Officer for RiskX and have been involved in RiskX now for 20 odd years, both in health and safety management and in building our health and safety management systems.
Thank you both. So let's get started. So Nikki, what is COVID anxiety?
Well, first of all, anxiety in general is just a normal reaction to uncertainty or things that may harm us. And when we refer to COVID anxiety, we're of course talking about those specific uncertainties and potential dangers that the pandemic brings. So before I expand on that any further, I think it's really important to just reinforce how prevalent COVID anxiety is, as well as anxiety in the workplace in general, as evidenced by various different studies. So, for example, the Office of National Statistics has reported recently that more than half of adults, so 53% of adults, said that the pandemic is affecting their well-being, whilst nearly half of them reported high levels of anxiety. Similarly, the national charity Anxiety UK has reported a 364% increase in calls to their helpline at the beginning of lockdown. Another charity, Young Minds, which supports young people with mental health needs, reveals that 81% of respondents to their summer survey have said that the coronavirus has made their mental health worse. What's really important and frightening in some ways is the background that we need to consider this against. So according to the HSE, work-related stress, depression and anxiety has accounted for more than half of working days lost in 2018 to 2019, their most recent survey. And Deloitte have estimated that this costs up to £45 billion per year. And of course, COVID will almost certainly have increased that. Why is that relevant to SMEs? Well, SMEs make up 99% of the UK economy. So it is a stark fact and a stark challenge that the SMEs are having to face. So now I've set that scene, what are the main causes of the COVID anxiety? Well, there are several, but generally they fall into 3 different areas. The first and the most important one being, of course, the fear of contracting the virus. And employees, it's important to remember, they're not just fearful for themselves, but for their children, for their families, for their friends. And the household status of every employee is really important when considering how to support an individual employee. The second area of concern is around the use of public transport and visiting public places. So of course, when we're talking about going to work, a huge percentage of our working population rely on public transport. So it's a major factor to consider. And then we've got, thirdly, the fear of adapting to pre-pandemic routines. And we need to remember that anxiety in returning to the workplace is just layered on top of the new anxieties that we were all new to at the beginning of lockdown in the first place. The levels of change that we've experienced, and certainly in my lifetime, has been more drastic in 2020 than any other time, and I hope any other time going forward. So that's the background in terms of the basics of COVID anxiety, and we're here to talk today about how that can impact upon businesses, particularly small businesses, in their ability to resume and maintain operations post-lockdown, and importantly how they can help employees feel confident in returning to the workplace. In small businesses, and many of you I'm sure have got 5, 6, 7, 10 employees, you only have to have 2 or 3 of those employees to be out of action or not fully productive because of absence or anxiety to bring your operations to a standstill. And sort of my final point on that is that it's really important to remember that employees do have a legal obligation as well as a moral obligation, and that's small businesses and large businesses, to safeguard both physical and mental health of their employees.
Thanks, Nikki, that's great. So moving on to question, I suppose, for James. So what are the employees' duty of care responsibilities surrounding supporting employees who are experiencing COVID anxiety?
The employee's responsibilities over COVID anxiety starts to stem itself when it comes to stress and mental well-being. We've seen this in workplaces long before COVID, and it's very proactive at the moment, where organisations are undertaking assessments of individuals, one-to-ones, bringing in occupational health. And with things like COVID, what it's brought about for us is lockdown, and having your children at home, and not being able to do normal day-to-day routine things, and maybe also their outlets. Although we had exercising and being able to go out and exercise, that outlet would have been a big issue. So the responsibility of the employer is to remember that although they're working from home, they are your employee, sorry. And for that, you need to understand their well-being and understand if everything is okay. In health and safety, it can be very difficult because not everyone is open. And undertaking assessments, either anonymously or as one-to-one, is vital in that. Understanding productivity drops, stress indicators, such as they're not looking after themselves, for instance, even when it comes to things like on camera. There's been a study on that. Getting up in the morning, having routine, all these kind of things, which actually workplaces enforce because of the nature of what they are. So it's very important that you understand that duty and you don't leave it at the door thinking they're at home, there's nothing I can do, that's down to them, else it will have that impact later on.
Thanks very much for that, James. So I think moving back to yourself, Nikki, so how does COVID anxiety affect productivity in the workplace?
There are two main areas to consider here. Firstly, there's the overall practical impact of having less people fit to work. Now, of course, there's lots of reasons why people won't be fit to work during coronavirus, related to being in isolation, related to their perhaps having vulnerable people at home. But anxiety is a really big part of that. And certainly when I speak to our clients in terms of how COVID has impacted their operations, they are just as concerned about anxiety-related issues as any other issue. So moving on from the practical impact, the second area we need to consider is how COVID anxiety affects the employee's ability to focus on their daily work tasks. And acute anxiety really can impact upon that significantly, rendering them far less productive. So we think about addressing that first point then, which is overall around the practical impact. First and foremost, whatever size of employer you are, you need a way of tracking who is and who isn't available for work, so that you can plan your operations accordingly. For a small business, that's clearly even more important to have a handle on that. If you've got even 10 people off work, that may represent 30% of your workforce. And if they're unavailable for work at any one time and you've not had any kind of foresight to that, the likelihood is your operation will stop or be severely impacted. And whilst there is no magic bullet for smaller businesses where maybe half their employees are off COVID related for any reason, then at least the more notice you've got, the more chance that you've got of finding other ways to maintain your operations or to refocus what you're doing. Addressing that second area of how COVID anxiety affects employees' ability to focus on their daily work tasks, well, this is more complex. And so there are several studies and more coming out every week, as you can imagine, that points to the fact that there is a direct link between COVID anxiety and productivity. And that should be no surprise. Impaired ability to focus and concentrate tends to be one of the first signs or symptoms of stress or anxiety or worry, either because sufferers are having difficulty sleeping, they're distracted by health or financial worries, and we need to remember that the mental health of our employees has been drastically affected by the impact of COVID from an economic perspective. Many of our employees are although healthy themselves, are living in households with people who aren't so healthy. And of course, really sadly, some of those employees have lost loved ones, either to COVID or through other means, through this lockdown period where they haven't been able to access the right services or carry out their grieving properly. So all of those things will add up to an employee being less able to focus and concentrate. On top of the fact that simply they are finding it difficult to readjust to just the new normal routines. Many of these anxieties, and we know this from several research surveys, relate to a lack of confidence. So you will see lots of information in the press, lots of information on social media about restoring confidence. And whilst there may be no physical reason why an employee can't return to the office, for one reason or another, they don't feel confident in doing so, either because they are worried about contracting the virus through public transport getting to work, or they're just not confident, or they just don't understand what you are doing as an employer to protect them and to safeguard them. So let's start talking about how businesses can help to restore employee confidence then in returning to the workplace. First and foremost, restoring confidence starts with businesses demonstrating that they have done absolutely everything within their control to control that, the possibility of transmission of the virus. So there are the basic essentials around how you visibly provide reassurance to your staff around creating and communicating is key. Strong COVID secure processes and policies, so social distancing measures, for example, appropriate PPE, and importantly the means for employees to be able to follow good hygiene practices, having access to good facilities like clean kitchens, for example. Then we need to consider how we support individuals specifically, and that's specifically to what their particular circumstances are. The most obvious one is around being flexible around allowing home working. And we know that lots of businesses, particularly small businesses, are now moving to a more permanent new normal and able to save money and costs on having business premises by allowing people to work flexibly from home. But of course, not all businesses have the ability to do that, especially physical businesses like construction companies, for example, or companies whose employees carry out manual roles or need specialist equipment that they can't have at home. But there are still ways that you can help employee confidence with feeling safe to return to the workplace. And that's some examples of that around, for example, staggering start times to allow commuters to travel outside of peak times. And that's particularly important in major conurbations where most people will be using some form of public transport to get into the office. What's really key here is that an employer has a look at what the timetables are for those transport mechanisms so that you can understand how you might be able to stagger start times or introduce shift patterns. Another key way is to introduce a phased return to work so that people feel supported and are able to gently introduce themselves back into the world of structure and moving outside of their home. Really importantly, carrying out regular health status assessments. And making sure those health assessments don't just cover the employee themselves, but they cover the households that those employees belong to. I don't know about you, but certainly when I'm going into a public situation, whether it's work or whether it's something else, one of the things that I will be considering is what is the likelihood that somebody that I'm in contact with has the ability to transmit the disease to me. And if I know that there is really good health surveillance going on and that my employer is not just understanding what the risks are for an individual, but what their status is at home in terms of their household status, and then that gives me more confidence that my company is doing what they can to control transmission at source. Lastly, and really importantly, is communicating effectively. Again, I'm going to share some stories of some of our clients and those that have found a minimal impact in their business, or they've been able to maintain operations better than they expected, was because they were taking regular time out to have supportive two-way conversations with their employees, and importantly to help their employees amplify their COVID safety voice. So to make employees feel that they are being listened to, respected and taken seriously, and importantly supported if they have a specific concern that makes them anxious around COVID. So in other words, the key to this is making sure that, that you can create a culture where it's acceptable to talk about COVID and it's okay to talk about mental health in general.
Thanks, Nikki. So I think you just mentioned there, but can you give us some examples of where clients have managed this well?
Yeah, so for some context, as a health and safety service provider, we were the first port of call for many of our clients, naturally at the beginning of lockdown, because they were looking to develop their health and safety services and software with us into a COVID management solution. And so during lockdown, we worked with several of our clients to develop a COVID health status software tool. So initially, we developed a free tool, and we were lucky enough to be sponsored by our hosting partners, Rackspace, and to be able to offer this free of charge to our clients. And we've got something like 100 people use, 100 different businesses using that portal now, of which about half of them are small businesses. You'll find some information at the end of this webinar for how you can sign up to use that free of charge. And since then, we've built on this free tool to develop a more comprehensive health and safety tool. It's called Safe Today. And I've had the opportunity to speak to several clients over the last couple of weeks who've implemented Safe Today to understand what the impact has been on their business and importantly, their ability to maintain COVID secure operations. So one example I can share with you is one of our clients who provides domiciliary care services. So you can imagine the risk and the associated anxieties that are experienced by staff who are delivering care into people's homes. And they're not just concerned for their own health and safety, but they're concerned about minimising any risk of transmission to the vulnerable people that they are supporting and helping. So this particular domiciliary care company uses our Safe Today solution for two things. One, for resource planning, so that they're able to analyse the fit to work status of their care workers so that they can plan effectively for resource to make sure that they've got enough cover and enough care workers to deliver their services. But also they're using it as a proactive tool to identify those who may need extra support with dealing with COVID anxiety. So one of the questions I asked the head of health and safety at that particular company was, what has been the impact on your business, if any at all? And he said very resolutely that employees felt that robust health and safety surveillance has provided them with faith that the company were putting staff front and centre of their operations during the pandemic. And they run safety culture surveys and a lot of two-way feedback mechanisms in order to be able to get those insights. So again, that's a piece of evidence where some technology is being used to enable managers to visibly show their staff support during this time and to make sure that they're not going to be in a position where their operation stops because they're not sure who's fit to work in what locations, delivering to what clients. So similarly, another one of our clients, and this client provides justice services across the UK, have reported seeing positive employee engagement during COVID, and that's because they've revised their health surveillance processes. And as part of that, they've used Safe Today as a platform, not just for surveillance and not just for compliance, but mainly so that they can allow line managers and people managers to have empowering two-way conversations with their team members about how they can work collaboratively to ensure the workplace remains safe. And again, this client has also reported a decrease in absences related to COVID concerns. What these two very different businesses have in common is that they're focused on creating a culture where it's okay to talk about mental health. And it's important that they demonstrate a commitment to support those individuals with personal action plans. Both of those companies have personal action plans for managing COVID risk and COVID anxiety out of the back of health surveillance. But before we move on, I think possibly now is a good time to sort of bring up a quick poll for participants to answer for us around who is taking the lead on COVID health surveillance in your business. So generally in most businesses, health and safety and HR both have an overlapping set of responsibilities for the welfare of their employees. It'd be really quite interesting to know from you guys how many of you take the lead in HR, how many take the lead in health and safety, and how many work literally completely collaboratively. So Craig, can you pull that poll up now?
It's up now, so people are just answering it quickly for us. So as soon as we've just got a few more people to answer, and then we can publish the results for people. A couple more to go. I think we'll just close it there. And so there is the results.
Okay, so that's really positive. So 43% of you are working entirely in collaboration, HR and health and safety. And we have certainly seen the pattern with our clients that where that is the case, their health and safety and their management of COVID anxiety has been far more effective. And that's partly because there are more teams working together to support employees, but it's also because there's information sharing and collaboration going on. So there is more data and information available to make decisions on how best to support people. Okay, in terms of other examples of customers and how they've shown good practices in managing employee engagement and COVID anxiety, James, can you think of any other examples that I haven't shared?
Yeah, I think the one thing that I've identified from a technical point of view is how supportive the clients have been in providing more enhancement and update. Yeah. So we've been developing the tool since more or less we went into lockdown, and we've shared that quite a bit with clients and taken on a lot of feedback off the back of them as well. And we have nearly 400,000 assessments, I think, in the system being done. And we've always said the same thing really across our client base, that if we can save one life by utilising this service, then that's going to make us happy, essentially. So it's been really good to engage with end users and come up with really good and creative ideas to make it as quick as possible. We always went under the remit of, we buy any car, we wanted the assessment to be just as quick. So a lot of these people can do these assessments for the first time within 20 seconds. And then from then on, it's 2-3 seconds just clicking a button to say, yeah, there's no difference from yesterday. So it's been really, really good in working out really clever ways to make this engaging to end users over huge populations and over small populations.
Thanks both. So I think before we move on from the topic of COVID and anxiety and productivity, can you summarise the key points on how small businesses can support their staff in their area?
So we've got a slide up, haven't we? There we go. There's the slide. So I've got some points in this slide. If you can go to the next one for me. So a couple of key points in supporting employees suffering from COVID anxiety and coming forward with this. Now, I know there's a lot of guidance out there, and a lot of people, especially in health and safety sector, we say that we're a little bit COVID out. And I think it's very easy to start ignoring some of the guidance or presuming certain aspects as well. So I've put this into some parts that I think are worthwhile for you all. So the first one really in helping to support employees that are suffering is the employee confidence. Are checks being made? Nikki spoke earlier there about having assessments and understanding whether someone I'm working with, have they been asked the question, are they well? I don't know. If I pass them when I'm going to get a cup of tea and so forth, I need to understand really that the people I'm working with, whether I'm socially distancing or not within my work environment, have been asked those questions. What is the confidence? What is the business doing to help the checks and maintain the controls? So it's really important to work on that employee confidence, and a couple of things later in the slides will help with that as well. Providing support and equipment for those working from home. Now, I know I've got personal people that I know working in other organisations which they really didn't have anywhere to work. They would work from home, and they were at some points in their garden on a table because they didn't have somewhere within their house, and that's obviously changed. It took a little while for people to adapt and bring things back from the office, and obviously it all happened very quickly. These are going to happen, but your work environment is really, really important, and it's up to you to help support that as much as possible and make sure they've got the right equipment and that they are comfortable in their work. We know about the DSE regulations and understanding the work side and the workplace aspect, and that's very important. They can't be working off a bed with a laptop on their lap, as it were. There's only a certain amount of time that becomes plausible with the health and safety executives and EHOs before it's like, well, actually, you've had enough time now to sort this. So it's important to have that equipment for them as well. Regular communication of business matters, direction, and COVID control. A really big topic that I actually think is missed. There's a lot of uncertainty out there. What with the furlough scheme and so forth, there's a lot of uncertainty. So if you step one side from health and safety, a lot of anxiety is coming from the fact that they really just don't know what's going on. They don't know how the business is being affected, how their work is being affected, what's going to happen. Are we going back to the office? There's so many different kinds of questions, and that will stem down again to COVID anxiety, which ultimately comes into stress management, and it all interconnects. So having regular communication, and I appreciate in businesses you can't always be as honest as you need to, but at least at a high level, understanding what's occurring and what we can see is happening becomes a really important statement as well. And that also comes down to the COVID control. They want to understand what the business is doing, and also it's a good way to give them a bit of a kick that this is exactly what we're doing. I've got hygiene practices, we're doing this, we're doing that, and we can soon forget. So having that regular communication becomes really important. Involving employees in the development of new COVID risk assessments and policies. You'll see in my slides further down that this is important in health and safety in general. When you create any kind of policy or procedure or risk assessment, one of the best ways to get buy-in that I've found over the years is to involve people, involve employees, involve operators, because they understand the processes very well. And actually by having that involvement, you get buy-in straight away. I've worked in organizations and helped them separately with health and safety consultancy, where they'll have what they might see as a troublemaker in health and safety. And they seem to shy away from that person. I say embrace them, get them involved. And what will happen is they'll work with you a lot more. They'll feel like they're involved. And sometimes they come up with some of the most honest and creative ideas. So work with employees to create the policy and understand their requirements and how maybe that's not something that will be easy for them. So how about we do it like this? You'll get lots of buy-in. And then the last one is reviewing KPIs. Probably the one thing that people forget. People are put under KPIs and stress, and they've got to report this and do this, and they've got to get all these things in on time. But around that, they've got their children working from home. They've now got lockdown. They've got their own mental state and so on and so forth. So a lot of KPIs may not be met. What is the organization's basis on those KPIs? Are you going to just put them to one side for a few weeks? Are you going to readjust them in accordance to what they're doing now? And again, it's helping with that stress management, which ultimately is that anxiety over having this pandemic. So it might well be that you have to adjust those KPIs. And again, it comes to that point above of working with them to understand what might well be acceptable. Because if you can make a happy environment, it will thrive. There's an amazing report out with regards to thriving in workplaces that was done a few years ago on that basis, that if you can allow them to be productive and make them feel that they're not pinned against the wall all the time, you actually get even more productivity out of them. So hopefully that's given you some really good key points in helping with the COVID anxiety that's slightly business orientated, and then it obviously stems into the health and safety aspect as well.
Yeah, thanks very much, James. That's been really helpful. And I think we'll now move on to the basics of achieving a COVID secure workplace. And I think the best place to start is obviously the government guidelines. James, do you want to tell us a bit more about the guidelines out there?
Well, it comes again, this is on my next slide, actually, if you don't mind showing my next slide. I didn't want to bring up the government guidelines, primarily because we will be here a lot longer than we need for this webinar, I'm sure. But we all know that those guidelines are there. And what's very important, I feel, is that there are sector-related based guidelines. So it's important to understand that not all the guidance is just completely universal. I would say that a good 70% of it is. You'll find that it will repeat itself within them, but obviously having a low risk office environment is different to having logistics. You also have to have hints of how people get to work, for instance. So there's lots of guidance there. And I've actually been quite impressed with how they've done that. But what I've done here is I've put a slide together just to help with a couple of other aspects, I think, which will help you, regardless of the size of business. So the basics of achieving a COVID secure workplace is the good levels of communication, bidirectional. Like we said in this slide before, you need to communicate with them. They need to be encouraged to communicate back, understand the current status quo when it comes to their health and safety, mental health state and productivity. Carry out a COVID-19 risk assessment. Sounds simple, and we will be coming to that a little bit later on today, but it is really important. It is important that you understand that being in such a pandemic does change controls. It changes quite a lot. And more than so, it changes the way people interact, and it might change the level of people you have over a process, which in itself could be a risk. You know, first aiders within environments, people that are trained to use various equipment, people shortcutting, all those kind of things. So having risk assessments alongside that becomes really important. Putting procedures and policies in place to increase hygiene practices. Now, I know I could say that and everyone would instantly say, yes, that's completely obvious. And unfortunately, health and safety and common sense doesn't always come hand in hand. And I think with hygiene practices, it's one of those things that can be forgotten the quickest. It can be very easy to completely forget the hygiene practices. People go into what are called alpha waves and studies in health and safety with regards to alpha waves where you do the same thing over and over again. I'm sure you've driven home and you can't remember the journey home. That's alpha waves. It's where the brain goes into a state of mindfulness where it doesn't record what it's doing. And hygiene is one of those things sometimes as well. You'll understand that you obviously people go to the toilet, they wash their hands and so on and so forth. But now what we're doing is we are sanitizing where our work stations, our workplaces, hand sanitizing when we're going in, out and so on. It can be very, very easy to forget those steps. So having policies and procedures is important, but communicating them and regularly communicating them becomes even more important. Maintaining distance measures where possible within the environment. I think, again, one of the ones that gets lost, it gets missed. We've seen it outside. We can see why there's been a change now with the legislation on Monday with regards to groupings and gatherings. I think a lot of the youngsters out there at the moment are finding that hard to do with regards to distancing. And again, with your workplace, it's important to have looked at it and proactively seen an in, out, an out route, maybe a one-way system. How can we have someone operating this lathe and there be enough room around them for something else? Does other things have to move? So it's an important thing to do, but it's also really important to regularly review that because what you'll find is as you bring in more people, you might find that those measures of space and distance don't calculate and work anymore. And I've also seen a lot of places where it looks amazing the first day we ever walked into a shop or an environment, but after a bit of foot flow, you can't see the signs on the floor anymore. So I think they're the kind of things that will need to proactively be looked at. Providing guidance and assistance to those working from home. I think, again, depending on your organization, some people are completely working from home. And I think where that's happening, there's a lot of communication because that's really how you're running your business. But obviously other organizations are having to do a bit of a mix, bit of a hybrid, and some have gone completely back to work. For those working at home, let's not forget them. Let's be proactive. Let's make sure that they have got everything they need. Let's not presume that everything's okay where they are. They may have certain stresses in life which they can't get away from because they can't go to a workplace. There is no outlet for them. So it's important to understand and give them guidance and some policies together and make that fairly dynamic, that as things change, this is how we're going to change our policy and communicate that out. Manage risk of transmission with close proximity required. You are required to do this. So for instance, you have space and distance, and we have all these lovely controls, but at the same time, you're going to have processes where people are going to have to interact. They are going to have to be a little bit closer. You can't get around that. And you'll know within health and safety, where reasonably practicable, that still comes into this. If you have to do that to get that process over the run, and it's a process that's seen as a priority to production and the organization itself, then it has to be done. What you will have to do is look at it independently and look at its controls. Do they wear face masks while they do it, for instance? Is there different sanitation processes, so on and so forth? It becomes quite an important thing to look at as a kind of siloed process. Don't just govern that under your risk assessment, generic assessment. It might be that that process itself needs its own method of ensuring there's no transmission of risk. Monitor employee symptoms on a regular basis. Obviously, systems like ourselves, they help with that, but there are other processes and management processes that organizations can do. I think it's a very proactive thing to do. It's very reactive to wait until someone has, turned around and said, "Oh, by the way, I've got COVID," but I've never asked whether I had a high temperature or should I come to work or should I should not. And I think from a consultancy point of view, I think what's important here is to not fall into that state of I'm going to send guidance out that says if you've got symptoms, temperature, so on and so forth, do not come to work, because they'll forget. It's as simple as that. If you have something that monitors on a regular occasion, so it turns around and says, is this currently the state of play? It makes them think, and it makes the liability go, yes, I'm not, or yes. And it could be in any way, shape or form. It could be a response to managers on a weekly basis, having a system that does it, whatever. But it's having the evidence to show that you as an organization said, have you got any symptoms currently? I'm just checking again. I'm just checking again. Because people will forget. I mean, if you look at near misses and underreporting within organizations of accidents, people forget to report an accident when they cut their finger open. This isn't something physical. And the last one there, being mindful of GDPR requirements. Obviously, this is personal data. It's legitimate interest because it's required for health and safety matters. So if it's a requirement for health and safety matters, under GDPR, it becomes a legitimate interest. So you can keep that data, you can maintain that data and utilize it for what you need, as long as you've got just cause for what you need it for. And my advice is, we don't know what this will turn into. We don't know how long this will be. You don't know tangibly how long you're going to need to keep hold of the data. So therefore, from an ICO point of view, I think everyone's got reasons to be able to keep hold of this data, as long as you keep it secure. Because you may need to refer to it later, either in a case claim or for trended analysis to understand how the organization went forward. And with the HSC, I think on the 4th of July it was, who put out a post to say that they are going to proactively start looking at what organizations are doing to prevent and maintain and manage COVID within their organization. There's obviously a threat there that they are going to have a look, and you're going to have evidential work to show what you did. And so it becomes quite an important thing. But GDPR, don't be scared of that. Don't use that as a reason not to do something if you have legitimate reason to, and you can be secure about how you're doing it. Just gain the information that you need. And the ICO have been very clear about that and said, look, it's a pandemic. This needs special consideration. So I think that's worth waiting in mind. So hopefully that's give you some really, really good points there on the basics of achieving a COVID secure workplace, as opposed to us rummaging through government guidance. But I would recommend that you do look at that guidance on a regular occasion and look at it at the workplace specific. There are sector specific guidances that you can look into as well.
Thanks for that, James. I think it was very, just certainly from our point of view, very pertinent. A lot of people forget about the GDPR requirements. That does scare people a lot. Yeah. Am I allowed to do this? So I think that's something that is key to it. So you've mentioned specific industries. Do you have examples of the guidance for specific industries?
Yeah, I mean, so for instance, with office-based environments, it might well be that you can undertake risk assessments and get people working from home as a general footing, because they don't necessarily need to come back. But where you've got people that are in lab technicians, for instance, or that are in logistics is a good one, because you've got workers that are driving and you might have shared vehicles. So therefore you would have to have a process whereby the vehicle itself is cleansed on a regular occasion within the dashboard, the environment, and so forth. So that's going to be different to say how an office would ensure. You've then got pubs, clubs, bars, they've got visitors. So therefore we need to have a track and trace of visitors that are coming in and out at the same time. You need to have really, really open and visual methods of how they should maintain COVID security, because you can't greet everyone at the door and say, this is what needs to be done. You need to, hopefully they're going to be responsible. So that's where there's slight adaptations. But what you will find is the majority of the guidance is is more or less the same. It's those smaller adaptations you'll get. And like I say, because there's so many sectors, it's worth going to the government's website and looking at workplace sectors and independently and having a look at that.
We can share the URL for that to make ease of reference better. So I'll just put that into the chat box towards the end.
Yep.
Yeah, that's great. So I think back to you, Nikki. Is there any tips we can give employers for engaging with employees, and visitors even to COVID secure workplace policies? Because I think that is the main thing, is it's about building confidence and being able to talk about it. Yeah,
absolutely. And visitors it's a really good point you make there, Craig, because visitors are a key type of person and stakeholder, especially for retail or any business service that deals face-to-face with customers. In terms of my overall advice, it may be a well-used mantra, but communicate. As is in most areas where employees need reassurance, or people in general need assurance, listening, responding and sharing are key to optimising employee engagement. We've talked today a little bit about technology, and technology is a really good tool to help employers pinpoint where support is needed the most. But it's those soft skills that are required to really reassure people of commitment. And on that point, I'll refer to a final client story that we've got. So we've got a client in the warehousing and logistics industry. They are an SME in that they employ around 130, 140 people. And they have, they're a user of our health and safety tools. And I had the pleasure of interviewing that client last week. They've reported relative success and growth during the pandemic. Now, whilst it's not a surprise that the logistics industry is showing growth because of the amount of online ordering and transactions that are taking place, in smaller businesses, they've really suffered with the challenges of not having enough staff at the right time because of the pandemic. This particular client has had growth in that period of time. So they've grown from 4 warehouses to 6 warehouses. So when I asked him how he did that, he talked about the fact that their strong safety culture is largely behind their ability to have continued and to have grown and to have expanded. And their use of technology has helped them with that. So they talk about the fact that their culture has been driven by employee participation, and particularly in safety and in compliance policies. So some examples that their head of business process management was able to share with me included site walkarounds. So site walkarounds is something that from a general health and safety practice they've always done. They've stepped them up. So they are doing site walkarounds for casual safety conversations, but they are doing site walkarounds as well to talk to people about their personal situations because of COVID. They have created an open environment for casual conversation at every level of seniority. As part of that, they have provided proactive feedback sessions and switched their focus on carrying out toolbox talks from basic safety concerns to COVID safety concerns. And they've switched their balance from safety to health and then safety. And really importantly, they talk about an open door policy to discuss individual concerns. So again, they are showing that they have a culture where it's okay to talk about mental health. And that's a theme that's come up several times today. What impresses me particularly about this client and why I've pulled them out to talk about is, as a result, they have seen no absence or productivity issues related to COVID anxiety. And that's through the whole of the lockdown process. And I think that's a testament to the fact that actually creating a good safety culture, using technology to help you decide on who to help and how, really does make your operation more robust to operate during COVID, particularly in a small business perspective. It's not a micro business, but it's still a small business.
Thanks for that, Nikki. So I think we'll move back to James now. So obviously you mentioned in your slide that's on the screen about COVID risk assessments. Can you just talk us through like the fundamentals of the risk assessments? Because I think it's something that a lot of small businesses need to go through and maybe don't understand fully what's required.
Yeah, so if you can go to my other slide, if you don't mind.
There we go.
So some useful tips here for updating a risk assessment in light of the actual pandemic itself. And some of these, they stem down to how we would interact with risk assessments going forward, but hopefully you'll find these really quite useful. So the first one is don't presume, actually document, demonstrate and communicate. And I say this because, again, with the pandemic, it can be quite easy to presume that someone's going to have a control and presume that someone's going to do a set action. Actually, what is needed is you do want to document that, you want to put guidance together or show how to do it if need be, and you need to get that out to your workforce as well and being able to communicate that out. It can't be siloed. Because at the end of the day, they need to understand. And again, it comes down to those aspects we raised earlier about the reassurance, because that's what they will see at the same time. So really go deep with your risk assessment and look at all your individual processes. Do not ignore the basic requirements. I've seen this in a couple of risk assessments for COVID where they've kind of scrubbed their generic risk assessments for their office environment, and they've created an all singing, all dancing risk assessment with COVID included. Not a problem with that. But what they've actually done is they've removed all the basics. They've removed the display screen equipment side of things. They might have done the manual handling aspects of various aspects within the environment as well, because they've looked solely at COVID. And so do not forget those basic requirements that you'll have, those fundamentals of just a general office environment or a workplace environment or a manufacturing logistic, however you need to. There are some basic requirements. Health and safety hasn't gone away, and nor has regulatory or any approved code of practice. It's still there. You just need to now adapt those controls to better suit a COVID environment. Keep it dynamic, reviewing it on a regular basis. Now, risk assessments, we fall into the trap, I suppose. I say trap, it probably doesn't, but we fall into the aspect of having a review period for risk assessments. The majority of that is done on risk level. So if it's high risk, it might be something you review on a regular occasion. If it's medium and so on, it takes a little bit longer. Unfortunately, COVID being as dynamic it isn't something that you can assess, walk away from. I would regularly look at that within an organisation, either big or small. It's not going to hurt you to have a look at that on a weekly basis or bi-weekly basis and just see if there is any changes that either you can make or that need to be made because of the actual guidance itself. So keep it very dynamic at the moment because the pandemic is very dynamic in nature. Consider the mental health health of the employees. Going back to our first slide there, our COVID anxiety, the risk assessment shouldn't be about objects. And I say that because we look at a manual handling or a machine or a chemical and so on. This is people, and a lot of this stems to people and their behavior as well. And if they're fit for work or their productivity as well. And that's going to increase in lost time and so forth. So do think about the individuals, how will that control make their job harder? Will that control make it difficult for them to really get their KPI and their process through? And more importantly, have we thought about our employees and their mental health? Is that in the assessment? Adapt to new controls where the process may need to change through restrictions. You will have lots of processes already. You'll have risk assessments already built for the processes. There's no reason why a lot of the basics of that has to change. But what you might need to do is change some of the methods because of COVID. It's now not a two-man job because of the spread of infection. It's now one man, but we've brought the size of the object down or the weight of the object down. So now it's more, it might take longer, but it's one person. These kind of things that where you might need to adapt. Space is going to be a big thing, having that distance in space. The cross-infection from someone handling something that then gets handled by the delivery personnel and so on and so forth. So adapting those controls is important. Consider if the process is a priority through the pandemic. Risk assessments always start with this, can you eliminate it? Should always be the first thing. When you look at a process, can we eliminate it? And can we reduce it and so on? And you go down that line when it comes to controls. And you should look at that with regards to this pandemic. Do we need to do that right now? Do we need to do it? Could the business, could we not do that now for the next 3 to 6 months and just see what happens with regards to the pandemic first? And you could actually eliminate some of the needs to put controls in place because you won't have those processes to worry about. And obviously that requires a much higher level business decision as well. But it is a question that's not always asked. You can remove the problems at this moment in time. Increase the level of reporting and monitoring. With the risk assessments you have at the moment, with processes you already have at the moment, you'll have some level of monitoring and surveillance. You'll want to look at how risk assessments are working. What's the cross link between a risk assessment of a process and injuries and illness or near misses? You know, that's telling you an awful lot about whether that control works. So you now want to monitor this probably even more so, increase it even more so. You know, we've got a COVID-based risk assessment. We have controls in place. Are they working? You know, is there vicarious liability? Are we seeing managers do unsafe acts? Does your manager sanitize his hands? No, he doesn't. Vicarious liability. So these kind of things, this communication with individuals to understand if things are occurring. You're only going to know that by having regular communication and monitoring. Involve employees in gaining their commitment. On the first slide, I think one of the holy grails of good health and safety management and risk assessment, involve everyone that you can in a process. Go to the operator of that lathe who's been doing it for 15 years. Ask him to help you with the risk assessment. How would you do this differently if you could only have one person doing it? I would do this, this, and this. You're going to get lots of buying. You're going to get lots of insight and knowledge. Consider a 2 risk factor. Now, risk assessments, obviously, your templates and how they work, you will have scoring matrices and risks and so forth. There's no reason why you can't have a separate risk assessment that sits alongside that, and you have different risk levels for the COVID side. You could even put it within the same risk assessment itself. Manual handling operation as it is, manual handling operation with COVID controls. And what that does is it also allows you then to have different risk factors. You can see that actually without those COVID controls, it's going to be quite high, but with it, it's going to be quite low. So you can put those into environments. I think they're probably more specialized. It's when you maybe have individual risk assessments, which I know is one of the questions, where you may have a process or an individual that has a higher risk factor because maybe themselves, they have underlying health issues. They may live with vulnerables and so on and so forth. You know, are you asking those questions in the first place would be the first answer. But at the same time, that will need some control. That person will need some control, not just the process they're working with, but their environment. So it might well be that you need to do an assessment on them and on their work practice and involve HR and occupational health. So again, that's where you can adapt and create some different risk controls if need be, of how you go forward with COVID specific based controls as well. Don't think as a COVID risk assessment as one assessment for your whole business. It's a very dangerous way to be because it's very generic. And if the HCs hate anything, it's generics, because that's what it is. It is generic. I'm not saying you can't have a generic umbrella risk assessment that sits at the top, but you will have processes which are specific to how it's adapted for COVID. Might be 1, might be 2, might be quite a few. And you could combine some, for instance, they might be very similar, but that's the kind of proactive control you're going to want in the long run to ensure individuals are looked after, teams are looked after, and then the organization is looked after at the same time. There's also a useful link here for a risk assessment template and HC website that we've got up on the slide at this moment in time that can be shared. And that gives, again, it's a generic side risk assessment. They've put in quite a lot of controls and quite a lot of aspects in there. It might look quite big and busy, but again, they're trying to cover all bases. You know your organization, and employees know their processes. They're the people you want to interact with. You can't download one, sign it, and expect it to be a COVID risk assessment. That wouldn't work whatsoever. You need to make this pretty unique to yourselves as well. So hopefully that's give you some really good tips in creating the risk assessment. I think people can feel it's a very daunting process. It's not, it's just a two-way process of understanding how you're currently controlling and what you can do to make that better.
Thanks for that, James. So just on, you just touched on it slightly. What about risk assessments for individual employees?
Yeah, so touching on that a moment ago, really, you are going to have those individuals. And you will probably be already doing this. If you've got, let's say, a pregnant worker, you should be looking at doing a risk assessment for a pregnant worker in the environment if it's got a risk level. So it could be that you have pregnant workers that are in logistics and warehousing. No reason why they can't work within that environment, but you may have various controls as well to safeguard them over a certain period of time. This is similar. COVID can affect people of certain ages within BAME categories, underlying health issues. People got asthma, people got diabetes. You know, this is where you have to connect with occupational health, connect with your HR, health and safety and HR, actually holding hands for once, you know, really getting on together and being able to look at it and say, right, this person over here has got underlying health issues. We know they've got diabetes, right? They're in a high risk category. So therefore, should we be not forcing is probably the wrong word, but should we be proactively saying work from home? Can we change their work so they're working from home, or can we give them another role in the organisation to work with? No, we can't. Okay, let's create a risk assessment around that person so that we can ensure the controls are really adapted to that individual, because we're mindful that person's got more of a risk. This is all about risk. So that's where you will have to adapt it to individuals. It might have nothing to do with underlying health issues other than you've just got a very high risk process when it comes in terms of COVID. And so therefore the two people that are working on that high risk process, which might have an element of contamination need, or those job roles probably need their own risk assessments as well. Thanks,
that's very interesting, James. I think now we'll move back to Nikki. Now, Nikki, you mentioned at the start, obviously, that RiskX is supporting clients through this. And do you want to give us a bit of information about, you know, what RiskX is doing about employee health surveillance in particular?
Yeah, absolutely. So to start with, the primary way we're supporting our clients is in a very business as usual manner. We are helping them keep focused on managing general safety risk outside COVID, albeit affected by COVID, and maintaining compliance with the various legislations that have remained unchanged despite COVID. So things like cost regulations and chemical management as an example of that. And it's really important to remember that employer duty of care obligations, they just haven't stopped for COVID. There has been no change to the Health and Safety at Work Act. So that's the first thing that we're doing. But of course, we are supporting them specifically around COVID. And I mentioned briefly earlier the development of the Safe Today COVID-19 health surveillance tool. I am aware of time, and so I will just use two final minutes of people's time just to go through a few slides just to outline very basically what Safe Today is. So if you're able to bring that up for me, that would be great. So essentially, Safe Today is a software health assessment module, and it's three things. One, it's a simple self-assessment questionnaire that employees complete. Now, I've said less than a minute. James has said less than 20 seconds. It is a very simple document. It is literally seconds to fill in. Really importantly, it's been pulled together following government guidelines on how to assess COVID risk. So it includes BAME, it includes underlying health conditions, it includes asking questions, really importantly, about people's households and whether or not they've got any vulnerable people living in them. So step one is the self-assessment questionnaire. Step two is our SaaS-based platform that captures this data and provides that data back out to employers and managers to help them do two things. First of all, to resource plan, and secondly, to help them identify where there are areas of concerns for specific individuals and supply the support that's required for that. And the third element is, because the COVID situation changes and risks change every day, is a simple ongoing email mechanism that allows employees to update their status very quickly on a daily basis. Craig, if you can quickly move to the next slide, that'd be great. So this screen here very briefly shows that questionnaire, and you can see how simple and intuitive it is. You don't have to fill in unnecessary questions, so there's conditional logic attached that certain questions come up only if you answer in certain ways to previous questions. The core details are captured of an individual and their households, and any key factors that need to be highlighted very quickly to managers are able to be highlighted as well. Next slide. Again, this just shows how visual the management dashboard is, that is based on the data that's gathered through those self-assessments. So right at the top, you can see the headlines: who is fit to work, who isn't fit to work, how does that differ from yesterday or last week. Then you've got options to drill down further into that data and export data out if you're big enough to require that to happen. so that you can look at specific locations. You might have 3 sites, and one of those sites is high risk, and you may need to make decisions about drafting people in from one site to another, or shutting one site down, for example, and you can use drill down options to look at that type of thing. And then you can see a breakdown of the key questions, and you can decide on which of those you want to look at. Those that have tested positive, those that have had a test but are awaiting results, those that are just at risk of infection because they fall into a vulnerable or at-risk category. And then finally, the last slide. This slide just shows how simple it is for employees to fill in the self-assessment questionnaire. It's all done by email, so there's no app to download or to train people on. And this has been the key to the uptake that we've had in our clients. So the first picture there shows you the email that an employee will get on a daily basis that basically says, has your situation changed? If it remains unchanged, and you click yes, finished. You don't have to complete a new assessment that day. And importantly, the assessment will go into the system to tell managers that that person has confirmed that nothing has changed since the previous day. And then you can see in the second window there is the automated thank you message that employees get once they've clicked on that button. So the final slide, if I can just stay up for a few seconds while I finish, will give you the link to the free sign-up tool. So I mentioned we do have a freemium version of this tool that's available to the end of October. At the end of October, you can either download your data from it and then work with it in your own system or your own way, or you can upgrade to the Safe Today option. So as a final point, once you've clicked on that and registered for the free Safe Today product, you'll get it's going to a holding box while we release that, and we'll aim to do that within a matter of hours. So perhaps Craig, if you wouldn't mind copying that link into the chat box.
Yep,
so
I'll do that. Just one final question, I think, I know we're a bit over time, but just over obviously data protection. I take it this, as it is a health and safety tool, it will be covered under, like it is, you are able to collect the data and hold the data due to the nature of what the data is. Yeah,
so this comes in the legitimate interest of GDPR. And what's important is we're only getting the information that we need to make these assessments. So for instance, even when it comes up when it says age, it's actually ranges. It's not a specific age. It's only asking what's needed to make an assessment of the level of risk. And we, as RiskX, have been doing online health and safety management systems now for 20 years. We hold personal data every single time. So we're not coming out of the woodwork and starting something new. We're well versed in this and have all the ISO credentials over information security management. We have things like UK Parliament that utilise our services. So you can imagine the restrictions of data that we have to go through when it comes to checks. So data will be secure, and within GDPR, it's all there ready to go. And there's statements there that give data controllers peace of mind as well.
That's great. Well, I think certainly from our point of view, it's been very interesting talk. So just Nikki, James, you have any final points you just want to cover before we sign off for today?
Yeah, I think for me there's two main points, and that is COVID anxiety is real, and it requires time, it requires understanding, and it requires managers to be able to access information to know who to support in what way.
And for me, it's really, from a health and safety point of view, and then from a technical point of view of writing the software, you know, it's only going, the impact of having someone have COVID within an organisation can be huge from a productivity point of view, and touch wood, if it goes down to a fatality issue, then the issue you have there is the counselling of the employees as well, and have that knock-on effect within the basis. So this is really, really important. We shouldn't take our foot off the gas, as it were, and as a nation we need to be doing even more to make sure that we are proactively managing COVID, else this will not go away. It will just keep coming back and keep coming back.
That's great. So, well, thank you very much everyone for joining us this morning, and thank you very much especially for Nikki and James. I think, as I said before, this has been really interesting, and I think it will be really helpful for small businesses because it kind of breaks down the kind of fear factor of risk assessment and health and safety in the workplace. So thank you very much everyone for joining us, and we'll see you in the next one.
Thank you.
Thank you.